Dr. Kevin Kavanagh is a retired physician and also founder of a national organization called Health Watch USA. Hey, good morning, Kevin.
Good morning, Jack.
How are you?
Doing really good this morning.
I find a story this morning that says Dr. Fauci has said that he expects United States to resume administering Johnson & Johnson COVID vaccines by Friday. Have you heard that?
Well, I did. That was on the news yesterday, and I'm not surprised. I'm still baffled at why they stopped administering them over such a rare occurrence when you have a virus that's raging. Because remember, with only one dosage, those individuals can become vaccinated much faster than if you have two doses. And so that's important, especially with these variants. Even with the UK variant, if you just have one dose, you can get an infection with that. It requires two doses of the other vaccines. And so I really do think that he was correct when saying that on Friday we need to get back using Johnson & Johnson. Unfortunately, the vaccine hesitancy it may have spurred is somewhat distressing.
Yeah, I hope it's not going to be the kiss of death for that particular product. Some other things we talked about this morning, Americans are going to soon be permitted to enter France for the first time in more than a year. Is that right?
That's correct, but they will need a vaccine passport, and that's going to be similar to other European countries. So that although that is arising as another political issue in the United States, in other countries, they're embracing that strategy, and it's probably going to be one of the best ways that they can get back to normality. So I do feel that vaccine passports are going to have a role, may not be as big in the United States as other areas, but they are going to exist.
We're going to have our Fox News reporter in London, Simon Owen, with us next hour. We'll actually ask him about that when we have him on. Brazil, the highest daily death toll. It's been a nightmare on top of a nightmare in Brazil, hasn't it?
Well, that's correct. And, they have the Brazilian variant there, which has reduced susceptibility to the current vaccines, which, although it should prevent hospitalizations and deaths, or hopefully will prevent that, the Brazilian variant is something that can still cause infections along with severe problems. And unfortunately, in Brazil, only 3.8% of the population is fully vaccinated. 12% has had one dose. And that is a good warning for people if you decide whether or not you should get this vaccine, because if you don't get it, we may turn into Brazil. This is all within our control. We have more vaccine doses than we can deal with in Kentucky. According to the governor, there's almost 500,000 doses sitting in a refrigerator, waiting to get into arms, and there are almost 10,000 appointments available throughout the state. In other words, they're not being filled. So this is all within our control. I mean, the good news is we have an easy out to get back to a more normal way of life. The bad news is some of our population, and unfortunately they're clumped together in certain areas of the state, one segment of our population really isn't embracing this strategy. And that is not good for the state. We need to have people to become vaccinated. This is a public health issue. It's not a political issue. It's a public health issue.
As always, a pleasure. I very much thank you for being here, Dr. Kevin Kavanagh. Thanks.
No problem. Thank you, Jack. Bye-bye.